Welcome, everybody. I'm Mauricio Towen, and I serve as chair of the Department of Psychiatry at UNM. It's a pleasure and an honor to have you here tonight. You could have been doing something else. Let me tell you a little bit about the department. Of course, our main mission is to take care of the mentally ill in New Mexico. We train people to take care of the mentally ill in New Mexico, and we conduct research to benefit those who suffer from mental illness in New Mexico. Another thing that we do, another of our missions, is community engagement, and this is what this evening is about. As we know, a well-educated community actually improves the outcome of those who suffer from mental illness. We know that those who suffer from mental illness suffer from stigma, prejudice, so we feel that it is our mission to educate the public. So again, welcome. We are very honored to partner with the city of Albuquerque, who's doing the transmission, with the Department of Health, and with the Albuquerque Public Schools. A few weeks ago, I was having a conversation with Dr. Barry Romo, and we were talking about, again, the mission of the department and what can we do to improve the lives of those who suffer from mental illness. Coincidentally, a few days before, the incident at Roswell took place. So we felt that it was really our obligation to do something about it. But what to do and what do we do best? Well, we are clinicians. And let me tell you something we're not going to talk about tonight, violence and the mentally ill. We're not going to talk about that. We're going to talk about violence and how it affects children and adolescents and what should be the response, okay? So the incident of Roswell brought a question is, what should we do when incidents like that happen? What should teachers do? What should parents do? What should the public do? And that was, I'm calling it an incident. Of course, it was a tragedy, but we see violence every day in different forms. So that's what we're going to be doing tonight. We have a very distinguished group of panelists, and we have asked them to talk about what should we do as a community when violence takes place. We're very honored to have Dr. Dave Graver, who is the Vice Chair of the Division of Child Psychiatry in the department, and he is going to be moderating the panel discussion. And Dr. Ramo, it is a pleasure to partner with you in this event. Dr. Graver.
Thank you, Mauricio. So actually, Dr. Ramo is going to moderate, and I'm a facilitator. And Dr. Keith asked me what a facilitator does, and I said, I don't know, but I'm going to do it. So thank you all for coming on a very windy Wednesday night. So I'll introduce Dr. Ramo in a bit. We're going to have 3 panels, and the information is up on the screen here. So we'll look at the impact of exposure to bad things and how to know if a young person is having problems. Panel 2 will talk about how can schools respond when bad things happen. And the final panel will be looking at ways of supporting children and adolescents when bad things happen. And then we would urge you to either write questions as they come to your mind if you have them on the cards. You can hold them up, and then I'll be collecting them and the ushers, and then we'll try to get to as many of them as we can. And then for some of you that are brave, we will set up a microphone here, and feel free, if you have questions, to go ahead and come up to the microphone if you'd like to directly ask a question. So I'm going to take just about 5 minutes and just lay a little bit of background to this topic that Dr. Towen had presented. So mass shootings there actually is a definition of mass shootings, and mass shootings is the death of at least 4 people in a single event. Not sure where that definition comes from. And since 2005, an average of 55 individuals have died in mass shootings in the United States, and there's been 15 since 1982. And this is victims by venue in the United States going back to 1982. And the details of this aren't that important, but just to say this represents school, religious, workplace, and others. And you can see it's very sporadic and it's very diverse, and there's no clear pattern to where these shootings have occurred. Now, when we talk about firearm deaths, many people will think primarily about homicide. Now, in 2010, approximately 31,000 Americans died by firearms. Of those, about 11,000 were actual homicides. Almost twice that were suicides, and about 600 were accidental deaths. So the majority of firearm deaths in this country are suicides, actually not violent homicide deaths. So let's talk a bit about school shooters. This has been in the news quite a bit, unfortunately. So what is the profile of school shooters? Now, these are just some general concepts for people that have researched this. So typically, in hindsight, they have recent threats of violence towards other people. They frequently will have their own suicidal ideation or behavior. And frequently, they will report having been bullied by a peer. The other thing that's not on this slide is that they typically are between the ages of 15 and 30 and are usually white males. Now, one question is why don't we identify these people and see if we can prevent some of these from occurring? Well, let's look at these three risk factors and think about how common they are in the general population. So these are some statistics from the United States in high schools. So about 1 in 10 high school student has been directly threatened or injured at school. And you're looking at 13 to 18-year-olds in any given year, 12 will report having thoughts of killing themselves. 4 out of 100 will report actual having plans, and another 4 out of 100 will actually have an attempt at suicide. In terms of bullying, 1 in 3 adolescents will report having been bullied in the previous year. So those risk factors for actual school shooters are actually relatively common in our young people in the United States. I'm going to talk just briefly again about some other bad things that happen and just how common these actually are. So in terms of sexual victimization, if you look at young people in the United States between ages of 1 and 13, 6 out of 100 will report having been sexually victimized. And if you look at an older group, age 14 to 17, almost 16 out of 100 will report sexual victimization. And 3% of adolescent boys, and 13% of adolescent girls will report having been attempted to be raped or have been raped. So these are unfortunately common. How about physical abuse and assault? So 1 out of 10 adolescents will report significant abuse, and so this is, by definition, needing to seek medical care, having left actual tissue damage, or being burned or tied up. And 17% of adults will report being attacked, threatened, or seriously injured in their young lives. What about witnessing violence? So about 38 or 4 out of 10 adolescents will report witnessing serious community violence by the time they're 18 in the United States. And about 1 out of 10 adolescents will report witnessing serious violence between their parents or their caregivers in the home. Death or loss of a loved one. About 1 in 5 adolescents will report the loss to homicide of either close friends or immediate family members. These are much higher in dense urban populations. Motor vehicle accidents or accidents, and disasters. So 1 out of 4 adolescents will report exposure to either a natural or a man-made disaster. And of that, 1 out of 3 will actually have significant fear of either being injured or killed. About 1 out of 5 adolescents will be involved in a serious accident, with about 10% in a motor vehicle accident. So why I raise these is that although incidents like Roswell or school shootings are very tragic, they're relatively uncommon, but some of these other areas are actually, unfortunately, quite common, and most of our young people will have exposure to some of these in their young life. And so what we really wanted to talk about tonight was that bad things can happen and are not uncommon even for young people. We want to really think about how can we and how can you all help. We want parents and teachers to have every tool possible to help children and teens cope with difficult news and events, and even those that don't directly involve them. And so tonight what we really wanted was to have the panels come together to discuss this, but also we really welcome your input into this discussion as well. So again, we'll have the 3 brief panels. You can write questions down and raise them and we'll pick them up, or you can come up to the microphone. And again, it's being recorded, and as always, we assume respect for panelists and audience members will be shown. So with that, let me introduce our moderator, Dr. Barry Ramo, who is a cardiologist in New Mexico for many years, and he has been associated with New Mexico Heart Institute for many, many years. He's a clinical professor of medicine and emergency medicine here at the University of New Mexico, and he's also a consulting professor of medicine at Duke University. And of course, he is the medical expert for GOV-TV. So I'm going to turn this over to Dr. Ramo, who will introduce the first panel.
Thank you very much. I'd like to say a couple of things. One is that for those of us who don't work in the university, what is always remarkable to me is the extraordinary talent that the university brings to our community. And psychiatry is no exception. I did a program on cancer recently and discovered this. And when you meet the panelists tonight, you realize what a great resource this university provides. And I see Dr. Keith over here, who presided over the department for many years and can take a lot of pride in that, and as well as Dr. Towan, who's come here and brought great credentials. But I did want to say that first. The second thing I would say is, and I'm really glad that Dr. Gerber did this, because he put together this panel and did a great job, but also points out to me, as I read about this and prepared for this discussion, is that we really live in a situation in which all of the sentences that we listen to are filled with terrible words. And we need an episode like Roswell to somehow be an exclamation mark to say, God, let's look at what's going on. There is so much violence, and it has such a profound impact in our families and in our children. So I have here three experts. I have Dr. Isaacson, who is an expert and has a remarkable background in going into situations in which there has been trauma. So he really goes in and helps people where there might be a hostage situation or problems in the schools, or most recently, people who are refugees from trauma and beating. I have Dr. Anila Delfrado, who is a clinical professor, is a professor here in psychiatry and works with relationships. And I had her on television the other day, and she was just fantastic. And Dr. Avi Kirschman, who also deals with family issues, again, going into communities where there are problems. Anila, why don't you make the initial presentation, if you would, and then we're going to have a panel discussion, and then we'll open up to you for questions. So think about your questions, and we'll move forward, but it should be a very exciting evening.
Great. Good evening, everybody. It is a privilege and wonderful to be here with all of you. And I'm going to be starting off with talking about trauma and how it impacts children and how we can recognize signs in children. And my two participants on the panel, they're going to help me with this. So what kinds of things are we talking about? And just listening to the two introductions, it occurs to me that there are so many bad things that happen to children. And we don't have it on the slide, but we have the Adverse Childhood Events Study, which does teach us that when bad things happen to children, it impacts them later in life in their health, both physical and emotional and mental health. So what kind of things are we talking about? One thing that is close to heart is victims of domestic violence. I work with a lot of moms and dads and babies, infants, toddlers, and preschoolers, and they're exposed to violence or they're at risk for domestic violence. Firearm homicides and suicides, Dr. Graber told us that 20% are, there are 20,000 that are due to suicide. Physical abuse and assault of children, sexual victimization. We see a lot of children who have been abused. Loss of a loved one to homicide, suicide, or illness. And I think that recently that impacted me personally because one of my preschooler's friends' father died very suddenly at the age of 36. And that impacted not only the child in her classroom, but everybody around her, including the teachers and the staff at the school. Natural disasters, we don't have too many here in New Mexico. Accidents like motor vehicles, falls, or injuries. and an uncertain future of self and loved ones. I got it. Why are some at higher risk for developing child traumatic stress? And we're talking about acutely after the event, or sometimes it can be a long time after the event. It could even be months or years after the event. If kids have been living through dangerous events and traumas, if they have been hurt, if they live in an area where there's a lot of violence, or they see people being hurt or killed, and Dr. Graber showed us some of those statistics. If they've experienced feelings of helplessness, extreme fear, and horror, if they've had a history of emotional problems, so if they have had a history of anxiety, school avoidance, separation anxiety, all these big names we throw at kids to indicate that they're very anxious and they don't like being away from their primary caregiver or the person that they have an attachment to. The amount of destruction, if it's a really huge event, that would make sense that it might impact them more. If it's a frequent, repetitive event, it might impact them more. And the reaction of the caregivers. And that's one thing I talked to Dr. Ramo about is kids will look to their parents and try and see their reaction. And sometimes as parents, we're blindsided and we may see something on the news or we may hear about something and respond in a way that may be scary to kids, especially little kids. And if we're freaking out, they're thinking this is a good reason to be freaking out. Lack of community support. So one of the things that's a really good buffer for children is if they have a strong community, they have a strong cultural background, they have a strong spiritual community, and of course their parents or the person that takes care of them the most. If they've been dealing with extra stress after the event, for example, Katrina with the loss of homes, the loss of schools, the loss of community, that was just extremely destructive. What are some of the symptoms? This is from DSM-5. So that's our manual in psychiatry. And so it's intrusive thoughts or re-experiencing. So bad dreams, frightening thoughts, reliving the trauma, avoidance. And that can be kind of tricky because people may think the kid's doing fine as long as they're avoiding something that reminds them of the event. Negative changes in thoughts and moods. So losing interest, for example, a teenager who's not doing things that he used to do, not going out, not involved in soccer or community events, and withdrawing. And increased arousal. So that's the feeling tense or on edge, being irritable and angry. Sometimes we call it hypervigilance, like when you're sitting quietly and someone suddenly opens the door, you jump or startle. And every kid reacts to trauma or stress differently. Some kids do not have any obvious difficulties after the event and they do fine. And different kids respond very differently to trauma. And two kids may have the exact same thing happen, but respond very differently. And there are developmental differences in preschool children, school-age children, and adolescents. And we'll do those three broad categories. Preschool children, and I'm sure you all know a preschooler, they sometimes have this magical thinking, or they think that things happen because of them and they're responsible. So we have to try and be aware of that and think of it in the developmental context. They can have feelings of feeling helpless and sad, and they can have worries and fears, and some of them are developmentally appropriate. Kids have anxieties and worries. They're scared that their parents will leave. They're scared that they will injure their body. They're scared of a slew of things. It's if it's persistent or it's a change. The other thing that concerns us is if we see a kid and they no longer have previously acquired skills. So a child who was toilet trained and is no longer able to go to the bathroom. Being unusually clingy with a parent or other adult, and sometimes that can get to a point of where they're refusing to do previous things that they were fine doing, like going to daycare or preschool. The need to act out the scary event, so we call it repetitive play. So sometimes parents will say they keep throwing the baby off the roof. or they can repeat some very traumatic event, a car accident or a fire in the home. And they can have sleep and eating problems. So they could have slept through the night or maybe woken up once, and now they're waking up every couple of hours and needing to go to their parents' room. School-age children, a little bit older, they may have some of the same things I talked about with preschool children. They may also have persistent concerns about safety. Is mom going to be safe? Is dad going to be safe? Are their siblings going to be okay? They start asking you whether friends, peers at school will be okay, members of their swim team, all kinds of things like that. A constant retelling of the traumatic event, which kind of reminds us of the preschooler who kind of has to repeat the play. Feelings of guilt or shame, that they're having these anxiety feelings or these preoccupations. Fear or sadness that gets in the way of daily activities, or their relationships at home or with their friends at school. They may also have, so some girls and boys do have differences in how they respond to things. Just broadly speaking, boys may get more irritated and aggressive, and girls may internalize things after a traumatic event. And that's a broad concept, but every kid is individual. So they may have out of control aggression and irritability. They may have difficulty concentrating, remembering, and staying still. And if it's because of a traumatic event and they have an underlying anxiety or depression, you could see that they may have real difficulties at school. And if we don't tease out what exactly is bothering them, we may think of a different diagnosis. Lots of physical complaints. They're unable sometimes to express what they're feeling, but it's much easier to say they hurt, they have a boo-boo, they need a Band-Aid. Sleep problems as well, and eating problems, and withdrawal from family and friends. And how do adolescents react? Adolescence is a hard age to begin with, and when a traumatic event happens, it could certainly impact that, and they may not want to talk about it at all, and they may have difficulty talking to their parents about it. I think an important thing to do is to give them the space and the safe feeling of safety, and I know the third panel is going to be talking about that much more. So they can be self-conscious about their responses. Part of it may be that they want to fit in, and this makes them feel different and weird, and they don't want to be different and weird. They may feel that they're going to be labeled as abnormal, that they're going to be bullied. Feelings of shame and guilt. Again, withdrawal from family and friends is a big one, especially an adolescent who's been enjoying going out with peers and doing sporting events. Fantasies of revenge and retribution, and a radical shift in perceptions of the world. And I think this goes across all the ages, but it manifests in different ways. They pretend it didn't happen. Thoughts or attempts at self-harm or other self-destructive or risky behavior. Getting involved in multiple fights, using weapons, wanting badly to hurt others. So I've certainly had some late adolescents who said, I just have this feeling building up and I just want to hurt people. And it's more related to them being exposed to a traumatic event than they might be perpetrators. Problems with attention and memory, and then drug and alcohol use, which could become a really big problem. They may turn to their friends for support and not want to speak to their parents.
Well, thank you very much. That was very helpful. Why don't we start out? The phone call comes in from a parent that their 3-year-old's been watching television, and there was a police shooting, not an unusual situation in Albuquerque. And the child is upset, but the child is 3 years old. How would you assess that child, and how would you then try to determine whether or not there really was a problem, or it was just a transient sort of phenomenon?
One important thing would be to notice if there's a change in their behavior, if they're repeatedly talking about the event more, what they saw, if there's changes in some of these patterns that Anila talked about. So noticing those changes that they may seem more sad or more anxious, just getting out of their normal routine, especially for a 3-year-old, it's hard for them to express themselves, so you really have to look at their behaviors.
Yeah, I think exactly that, a change in behaviors. Little kids like that can become mad at their mom or dad and get a little more aggressive with siblings. I think the sleep issue is a big one, and if they're not eating and their interactions with people that they've usually had a good interaction with can change.
And another thing is, I know that Anila likes to say that parents know best and know their kids best. So it's really an instinctive sense that something is very different, and being attentive to that and respecting the fact that you're picking up that the interaction is different, the behavior is different.
So is this something that persists? When do you start to worry about it? Is it first place, is it normal for a 3-year-old to even pick up on this? It just seems to me that, the television's going on, just another thing. This particular situation, maybe they did, but is it even normal? Do kids, 3-year-old, even understand this?
Yes. Kids are from very early on can know that there's stressful events. I'm thinking of domestic violence. If they're exposed to domestic violence, even babies as young as 9 months can have difficulties regulating, meaning crying, sleeping, and eating. So a 3-year-old who sees a shooting may not understand the context and may not understand the full impact of it, but it's scary. And mom and dad had a response, and I don't feel safe anymore. And I think that they may have very real reaction. You asked how long should one worry? I actually just saw a child recently, and we're saying it's an acute event. Let's wait 2 or 3 weeks. We did an evaluation. We gave mom some ideas of how to be present for the child. And when we're talking about post-traumatic stress, the clear-cut symptoms in DSM-5, that would be after that.
So Brian, you see a lot of people with post-traumatic stress disorder. Do you see 3-year-olds?
No, I don't work with kids that young.
Okay, but say a
yeah.
7-year-old. Oh, thank you very much.
So I would add that a lot of children who experience trauma or witness trauma actually do well after. A higher percentage of kids would do well after witnessing something or experiencing it, and then would have major problems. And so you'd want to look for these patterns we're talking about over an extended period of time, maybe a month or so. If it continues, that's when it'd be more of a concern. But a lot of kids are going to have a hard time right after something happens, and they're going to bounce back and they're going to do fine, they're going to be resilient. It's when it continues on over a longer period of time that you'd need to be more worried.
One of the things that occurs to me is that all 3 of you see people sort of at the end of a really manifest problem. But what advice do you have for a parent who's trying to immunize their kid? What sort of household do you do? I used the example today of a patient I saw today in the office who weighed 260 pounds, and he had gained 50 pounds since January. And he had a heart attack. And I said, well, it's hard to gain 50 pounds. He said, it's not hard. It's easy. And I said, well, we want you to take it off. But the problem was the only time this fellow really came to terms with the fact that he had a problem was when there was a Roswell or when there was a heart attack. So what are you telling parents? You see the sick one, the ones that are really severely ill, but still they have to go back into the family. What advice do you have?
I think as far as immunizing, it's more that we think of flexibility and coping and adaptation as health. And so a lot of what we are all 3 concerned about is the sense that people are fragile and frail, and that stress like this creates significant problems. Like Brian said, we know that the majority of children, adolescents, and adults who deal with very stressful situations handle them extraordinarily well. And that also brings up the issue that is very important to address, is not to push people to process things. That either if people are on the extreme of suffering greatly, to push them to experience things and talk about it and process it prematurely can be damaging.
So you think it could actually cause more trouble?
Absolutely. And the other thing is for those who are coping really well to honor and respect that and to really let it be and not to push and not to press, because like Anila was saying earlier too, if you're anxious as a caregiver, that anxiety is contagious. So
Right.
if you show that you have faith in your child's ability to respond, that'll immunize in the words that you were saying.
So we all have the feeling we ought to talk about it. And you're dealing with people who've been in really in brutal situations. You find some people just, maybe it's better never to bring it up?
Yeah, I would say that it's really important for parents, teachers, or mental health professionals to let the children know that they're available to talk, and we'll probably talk about that more in a future panel, but that they're available, but they don't have to talk about it, but they have to let them feel comfortable knowing that you're someone who they can trust and would be willing to talk. And I've worked with a lot of refugees who've experienced trauma, war trauma, and torture, and I can meet with them for months or over several years and not get into the traumatic events because they're not ready to talk about it, and that's not something I'm going to push. But they know that I'm willing to talk about that, and they're comfortable coming to me for that help.
I see. Well, let's talk about adolescents. I'm sure that you've all encountered adolescents. Where do you see they're coming out of all this? Because all of us have, anybody who's got an adolescent child knows how difficult it is to get them to tell you anything. In fact, I don't find my adult children tell me much. But so how do you get to those kids? Where do you get that information? Where do you as an observer, as a diagnostician, take an adolescent and try to decide whether this screwy behavior is really just part of adolescence or it really is pathologic? What do you look for?
Well, I think with adolescents, one of the things that they're very focused on is
Just point it this way, they can hear.
is peer relationships. So you may hear from their friends, or you may notice, their friends may notice a change in behavior before the parent does and bring it to the attention of the school or the teacher or the parent. So I think that's an important aspect for adolescents.
And there's sort of another bromide about people cannot not communicate. So there's all sorts of ways of communicating issues without talking about it. So for instance, if you have an adolescent who seems to greet you and look forward to being with you in family dinners and tells you about things that are happening in their life, and then clams up, withdraws, is not interested in being with their friends, is not interested in going out, that's worrisome. So you can communicate all sorts of issues without overtly addressing them.
Do you think you do that with the little ones? I mean, I have, as I listen to this, I'm thinking of, my 5-year-old grandchild and saying, maybe you were influenced by this. I don't know. Is there a tangential way to talk to them about this whole idea that there is violence out there, and that because the violence is epidemic. It's just it's the games and the superheroes and all of them are so violent. Is there what would you advise that parents do to try to help that out?
What you're alluding to too is about looking at games and things like that. That again, a lot of kids communicate non-verbally. So looking at their play, looking at their drawings, looking at the kinds of shows that they suddenly become more interested in than others. So you can get a lot of information by what they pay attention to and what they value.
Well, let me stop right here. I'd like to take some questions from the audience.
Yeah, I have a.
David, why
that on?
don't you go ahead and read them?
Yeah, I have a couple. So here's one question. I have a friend, don't we all, whose daughter got freaked out about going back to school after the Roswell shooting. Is this normal?
So that's a very good question. I would say, like we talked about, it is normal to have these reactions. From a mental health professional perspective, we would expect that kids would react in a scared way or a negative way after these events, because it is scary and that does makes them face their own mortality, right? If they're going to go to school, are they going to be safe? There's these questions they're going to have. And again, it gets back to how long do these problems last? Is that something they talk about constantly? Is their functioning affected? Are they really not going to school? Are they going reluctantly and then they have a good day after all? But if it's going on considerably, and there's a lot of avoidance where they're avoiding things to the point where they're not functioning at the level they need to, that's when we'd be more concerned.
Great, and then here's another question. I would, folks have questions, please feel free to write them, and if you want to come up, feel free to ask. This one was emailed to me earlier. My teenage daughter had a friend who was shot. I have tried to talk to her about it, but she won't. Should I keep trying to get her to talk?
So I think we talked about that quite a bit, about should you kind of force someone to open up and talk. I think the important thing is to be there for the child, and you know as a parent if you've had good communication before with the child, and that can be as important as anything. So letting them know that you're there when they need to talk and that you're open to discussing, and also as a parent being very factual and clear about, yes, it was scary, I was scared too, but here are the things as a parent I'm going to do to protect you.
Especially if you're talking about adolescents and their friends. If they're still maintaining that connection, then you're still creating that space for them to feel comfortable to talk. So maintaining the connection is a lot more important than pushing them to say something that's uncomfortable for them.
One of the points that Anila made when we talked really was this whole idea of safety. How do you convey safety to a teenager? What would you advise?
Well, I would say talking to them about some of their concerns. So again, being available, being open about what their safety concerns are, and helping them feel that they're part of making choices about promoting that safety. And so if they don't want to go to some activity because someone's going to be there that was a perpetrator or fear of something, then that's okay. Allowing them to make these choices. The safety is really part of helping them feel empowered to decide what is safe for them and having that communication to be able to talk about that.
And I'm guessing that Laura and Raven are going to be talking about how to feel safe even within your own body, how to feel grounded, how to feel oriented, how to know that the place that you're in is the place that you can actually be in and feel comfortable in.
And you've actually gone into situations where they're right in the middle of all this trauma. What do you do?
Well, I think it's, again, a lot of these factors that we talked about together. And I believe that the second group talks about things happening in the school. A lot of it is having all the caring adults feel that they're secure, that they know what to do, that they know how to talk to each other, how to talk to the kids, how to talk to the parents, and that if you generate that kind of concern and respect and security within yourself as a group, then you'll generate that in the kids that you're seeing.
That's helpful. Do you have other questions?
Okay. Hi. Closer. I'm a psychiatrist also, so I know the panelists. But I was really struck by the firearm numbers, the statistics that Dr. Graber presented. And I wanted to, especially the fact that in 2010, 2011, the number of suicides by firearm was almost double the number of homicides. So I wanted to ask you all how you talk to families about guns, especially families that have guns in the home and feel that it's important for them to continue to have guns in the home.
We're going to show them that slide.
I think the first thing to think about for families is about, again, that assuming and knowing that they really value their children and they really want to protect them, and thinking about the best ways to protect them and being respectful of what their values are, what their beliefs are, and trying to understand how those beliefs can connect to their caring and concern for their kids, as opposed to imposing our own beliefs or our own ideas about what we think is best.
What do you any other thoughts about that?
So do we have time for one more question?
I do.
Okay, so we have more questions than we're going
Yeah,
to ask.
I think just one more is
Okay.
all we have.
What might be the best route to help two young ladies, age 11 and 12, who are exhibiting suicidal tendencies, detachment from one side of the family, and significant behavioral changes.
I just talked.
Yeah, that's a tough question. And again, not knowing the girls specifically, it's hard for us to make a specific response, but being available, helping them to know that there is help out there, that you love them and you care for them and you really want them to be with you, and that help them feel that they have those connections, even though they may not recognize it, that there are people out there who love them and who are caring for them and are willing to address their concerns because they're communicating something, that something's not going right, and trying to figure out what that is.
Yeah, it just struck me that you said 2 young ladies of 11 and 12, so I wonder if they're in the same family or if they're friends. And I think that always concerns me, if there's more than one child who are friends or in family and they're kind of talking about it or texting each other or making pacts or anything like that.
And one of these issues relates to that people are really influential with each other, and especially with peers. So one of the things that we want to figure out is, what does it mean even when they think about being suicidal? Because a lot of times people say that they wish that they couldn't go on, but what they're really saying is the pain that they're enduring is insufferable, and they really don't want to die in that kind of way. So it's really understanding, what they mean, and the other piece of it that's really important is not making them feel ashamed for what they're feeling and what they're doing. To really honor that as the communication that needs to be understood and respected.
Well, with that, I think we'll close. And I really want to thank the Department of Psychiatry for putting on this really informative program, and thank the panelists who bring to this a wealth of experience. And of course, Albuquerque Public Schools and the city of Albuquerque were kind enough to do the videotaping. We really appreciate it. So we'll end with that, and thank you very much. I think you've given us some important information.
Thank you.